Let's talk about technology, right? You kind of hinted at with AI. My company, we kind of focus on remote care as a service, where we're kind of reaching out to patients in the home environment for remote patient monitoring. What are your thoughts about these advent of these tools and how they can be useful for you in the primary care setting as you think about, how you practice medicine?
I think it's amazing, honestly. Number one, it gives patients that sense of empowerment and that sense of involvement in their care. Before we had all of these fancy tools, we'd have.
Welcome everyone to Medical Success Secrets. This is Theo Harvey, CEO of SensorMed, and I'm super excited today of my guest, Dr. Shirley. How are you today, Dr. Shirley?
Hi, thank you guys so much for having me. Today's been relatively very chill. I just came off of my clinic block, so perfect time to talk about all the things that we want to talk about today.
Awesome, awesome. Well, Dr. Shirley is internal medicine focused on really about mentorship and supporting fellow residents and really showing her expertise on how to navigate the challenges that come with trying to get through residency and all that. So thank you for your opportunity to talk to us today a little bit about, some of the things that you're seeing, right, as you're emerging into medicine and the new way of treating patients. One of the things I want to start with is, according to Center for Disease Control, or CDC, heart disease remains the leading cause of death for both men and women in the US, over an estimate roughly about 697,000 deaths annually. As internal medicine resident, what do you believe is essential in addressing this issue, especially in primary care?
I think early on, even as an internal medicine resident, being at the forefront, especially because a lot of us in training and residency training are placed in areas that are underserved, underinsured as well, and being able to sit down with your patients and have a good talk with them, having that educational talk and advising them about what our cardiovascular disease is. So people just think heart attack, stroke, period, but it goes beyond that. Heart attacks, at the core of itself, it's a lot of clogging up of the arteries, and that because your body is full of arteries, you can have problems anywhere, right? So you'll have definitely stroke, brain, heart attacks. You can even have what we call peripheral artery disease. So a lot of the calcification, when a lot of that buildup of the bad cholesterol happens in the arteries down in the feet, that can even impair wound healing. And we see a lot of that as well, where a patient comes in and they have a very, very chronic wound, and we're just having such a difficult time treating that wound. Just throwing antibiotics isn't enough. Unfortunately, some people have to undergo amputations because of how severe the disease is. And even going back to the heart, it's not just about having heart attacks. You can have what we call heart failure. So that's when your heart becomes a much more weaker due to the lack of blood supply to certain areas. And that can be caused if you have a lot of these cardiovascular disease. Likewise, with a lot of what we call arrhythmias or funny heartbeats that could also be fatal. And that's because, again, wherever the blood supply is, again, it's a very systemic disease, and wherever blood goes, that disease can attack and that disease can affect that part of the body. So, in the primary care setting, education to patients is so important because I feel like a lot of people don't believe it until they see it. We
Mhm.
always talk about primary prevention, secondary prevention, tertiary prevention, and we always catch these patients once they're in that secondary or tertiary where they already have it, and we're just kind of trying to see what we can do to reduce the progression of the disease. But not a lot of people focus on primary prevention. So even as residents, having that 1 hour talk, or depending on where you're training, in my program, as first years, we're allowed to have like an hour with our patients, and then we are able to really give them education. And as you go by, you have to become a little more efficient with your time. And it's, of course, how the medical system kind of forces you to see more patients in such a short time. So just having your bullet points to really talk to about your patients about cardiovascular disease and risks. And going back in primary prevention, that's all about exercise, diet, lifestyle modification, identifying your risks. If you had a family member who's had a heart attack or has some sort of cardiovascular disease in their younger age, like in their 50s, definitely tell your PCP that. Say, hey, I'm kind of concerned because I have family members who have cardiovascular disease, and I want to make sure that I'm doing what I can to be screened appropriately. So I think just the importance of screening, just the importance of education to make sure that we're preventing the disease before it gets there is really important. I think early on, not even just as residents, medical students do it all the time too. And I appreciate my medical students so much when they take their time to talk to their patients and they're in there talking about this is what the disease is, sitting down and going over this is what kind of aerobic exercises you should be doing, or this is a proper diet that you should be following to kind of help mitigate those risks.
Mhm. You hit the nail on the head. I mean, with healthcare kind of changing a little bit, the push to see more patients, especially in, large healthcare centers. And as you mentioned, just the demand of your time, you really have less and less time. So having those top bullet points to kind of get to the patient around exercise, around diet, and kind of reiterating that helps. When some of the other medical practitioners I've spoken to on this program before, they have mentioned, how do you kind of create that educational environment where they're receptive to it? And one of the things that we came up with was just, like you mentioned, creating like a trust environment. And how do you do that quickly? Maybe with some transparency about, like, maybe your journey, from a health provider standpoint, and how you're managing, certain areas of your health as well. And that can get some of the patients to kind of open up. And so just trying to, create those environments so that they can hear you, right, and be open to and receptive to the education, because you're right, you have such a little amount of time, and the goal is to kind of, really impart powerful value, basically life-changing opportunities for them. So I appreciate your efforts to kind of put that together. And have you gotten to a point where you have gotten better at communicating the educational pointers around cardiovascular disease and diabetes even?
Actually, yes. So our program, fortunately, my residency program has a focus on lifestyle medicine. And how I see it personally is that some people are like, why do we need lifestyle medicine when we can already talk to our patients about diet and exercise? And I tell them, if you actually look into the curriculum of lifestyle medicine and the education that you're taught as a physician to impart on your patients is so much more extensive. And in medical school, I think we're just so focused on the physiology, the science, the medicine that if you ask anyone, ask someone, when was the last time you had a formal lecture on nutrition? Even just simple things. You're sitting there in your patient's room and you're telling them you have to go on a diet. And they ask, Doctor, what diet do I go on? And you're like, oh, that's the part that I didn't get to. So tying back into how I was able to get better, definitely there are a lot of pillars of lifestyle medicine. And this is like a whole conversation in itself, but it talks about health holistically. So not just your physical health, talks about your mental health, your social health, and it goes into diet and exercise. And I try to pull in elements when I'm talking to my patients, hitting those bullet points. So when I talk about exercise, I ask them, it's not just about saying you have to exercise for 150 minutes per week as
Mhm.
per guidelines. And you're just sitting there like, it's so hard. Like if I tell you right now, if I told someone else right now, hey, you need to go exercise, like I don't have that internal motivation. So really not just hitting the bullet points, but as they say, medicine is a science and an art. You build that art form. So sitting down
Mm.
with them and saying, what are our SMART goals? And that's where you pull in all of these things that you learned in college. What are your SMART goals, if they're attainable and things like that? And we talk about, okay, you want to start exercising. Let's talk about baby steps. I know it's overwhelming to think that you have to do 150 minutes. What can you do? So we go into talking about, okay, I can go for a walk, maybe 10 minutes a day. And then we progress and progress. Same thing with diet, especially in diabetes patients. There's so many patients, especially like in my community. So I'm Filipino and we love our carbs. Everything is carbs, 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 rice, rice, rice. And a lot of the Hispanic population, a lot of these other Asian countries, Asian population too that I deal with. And when you sit down with them and tell them you need to go on a diet, you have to also understand the cultural aspect that comes into
Mhm.
play that I need rice. Like I, as a Filipino, need rice. So you talk about, okay, here are our alternatives. How are we going to cut back on the amount of rice? Now there was this one patient I should say, and usually with these kinds of patients, I try to follow up with them when we're talking about lifestyle changes on a monthly basis just to make sure that they feel supported until I feel comfortable and they feel comfortable that they're at a pace where I can see my doctor every 3 months. I'll be fine. I don't need that every month kind of encouragement. And I remember I told her, we need to go on a diet because your weight is not only affecting your heart, but it's what's causing your knee pain and that
Mhm.
osteoarthritis component. And she didn't want to go to surgery and things like that. And she told me, I don't want to go on a diet. because I don't want to eat salads. I said,
Mm.
hold on, let's backtrack a little here. What is your definition of a diet? And then going on to that level where you're really communicating with your patient and not just throwing facts at them, throwing guidelines at them, going back to that level of human to human connection, and then identifying what can we change here. So in her case, she had mentioned that she loved, I think, just like a lot of fried foods. So I said, okay, let's kind of cut back on the fried foods. I understand, I'm Filipino, I need fried foods and rice in my life, but let's kind of cut back and see how we can start moving forward.
I think you hit the nail on the head. My community, African American community, a lot of sugar, with juices that we drink. Obviously, there's a lot of meat. So dealing with, too much meat sometimes can cardiovascular disease and things like that. And so to your point, find those substitutes, right, to kind of enable that. For instance, myself, just being transparent. I also, say, hey, I need to cut down sugar. Is there something I can eat that I like that, can kind of give me that sugar high, but that's not spiking my blood sugar up? And found apples, right? I love apples. It gives me that sweet taste, a lot of fiber in it, and boom, that helps, yeah, keep my blood sugar, at a sensible level. And so I think, having that art and communicating that to the patients is really key. Culturally sensitivity, right? Understanding the unique needs of every kind of, and not just from a race standpoint, but just from how people grew up, right? Even people who grew up in the South are different from people who grew up in the Northeast, right? And how they perceive certain things and what's the norms. And so I think that's so super important. I'm glad you're kind of looking at that. And the last point I want to hint on is like, I grew up on a lot of medical shows, and I remember House MD. It's a detective show, right? Oh, who cares about the patient? I'm trying to figure out what the disease is and solve this problem, right? And sometimes, because being a doctor, you're so focused on trying to solve the problem, help the person, you forget about the person. And so I think it has to kind of go hand in hand. And you kind of hit the nail on the head on that as well. When we kind of talk about how things are changing in healthcare, right? And as a resident, you're seeing as an education, you talked about lifestyle, understanding lifestyle and impacting that and how you communicate to patients. Are you seeing more medical students kind of coming in and want that type of connection to their patients? Or what do you think is happening for the future generation of doctors that are coming to the field and other clinicians? Is that more important now than ever, where they want to look at the holistic, understanding holistic care and how to help patients, not just from a disease standpoint?
I hope it is. I genuinely hope it is. And I hope that every medical student that follows me in clinic or in the hospital sees that. And mind you, I'm someone who's very much interested in right now, kind of in the critical care setting. But then, even if I'm interested in being in a very high acuity setting, that does not take away my passion for making sure that my patients are well informed and well educated. So, in
Mm.
every encounter that I have, from talking about the disease, I sit there and I ask them, has anyone actually come in to talk to you about the physiology
Mm.
or the science behind what's going on with your lungs or your heart? And sometimes you're like, no. Has anyone come by to show you how bad the scans look? Because sometimes patients are just in that room and thoughts are going through their head. They're not getting that, they're not feeling as empowered. And that's where you find that strain between patients and strain on the relationship between patients and provider when they don't feel as empowered with their care. They feel like, I don't know what's going on. They just said, I have a bad lung infection, I have a bad pneumonia. And sometimes I sit with them and I say, hey, this is what's going on. So setting a good example, and I know a lot of my colleagues as well are very try their best to show a good example. Now with the future medical students, I always tell them that, hey, it's no longer about how smart you are or how much you can memorize in a textbook. So many people have so many resources now. Even as doctors, we have resources. If we're not 100% sure, we have all these other like Dynamedics or like Up to Date or all of these other resources that we're able to use. Tying in as well with artificial intelligence, just that comes into play as well. I've seen it as during my rotations in the pulmonology clinic where they really go ahead and use AI to scope out what the lungs look like. And back then, you'd
Mm.
have to have a very, very good hands, very skilled. So I always tell them, guys, this is so easily accessible. My patients know. Like I was on the phone with my patient today, and she was telling me that, yeah, I read that metformin takes a while for it to kick in, and I just started it a couple of weeks ago. So everyone has all of this knowledge. Now we go into the art form of medicine. I think I always emphasize to medical students and colleagues that what makes you stand out now isn't just about how smart you are and how much you can put things together, but the way that you're able to, the art form you use to convey that with your patients, the art that you use to really figure out a treatment plan and how you're going to carry that out, the relationship that you build with your patients. So I hope that with the advancement in technology, people will realize that, hey, what do I have? What asset do I have that AI doesn't have? And just making sure that they still have that humanness to them, that art to them, and just making sure that they build relationships with their patients. I think that's like the most important part. If it's not me showing them that they should be building on their relationships and their interpersonal communication skills, and not just with patients, but interdisciplinary teams. You know, how you talk to administration, how you talk to nursing staff, how you talk to your custodians in the hospital. Like that ranges, and how you communicate and how you build those relationships has such a huge impact on what you do. The way you communicate with, let's say, health insurances, if we're going to go that broadly, and talking to them and defending, like, yes, my patient really needed this procedure. I need to communicate and convey to them that this is how serious, like, the condition of my patient was. So I think if it's not going to be us verbally telling them, it has to be them growing into that mold. That's the best way to put it.
Wow, you hit a lot of good points there, the communication aspect of it, right? Because you're right with AI, and even before then, right? People will want to get, second opinions and get other folks to kind of collaborate or understand if the doctor, what they told me was true and accurate, right? But now you're right, with these technology tools that have sucked up everything from the internet, patients can look up anything now and find out, the diagnosis and what's the most, likely treatment plan and the pros and cons. So when they come in, they're very well versed, and it can kind of have those deep conversations. And to your point, that's where the other skills come into play, right? How well can you explain it to them? Are you building that relationship with them? And then always, like you said, is not just, just your patient, but how you communicating to the nurses and communicating the care plan and making sure you guys are aligned, communicating to your higher ups in the hospital, and also to your colleagues, right? Who have different skill set, and communicating that effectively. If patient needs surgery, how do you communicate the challenges to that surgeon and things of that nature? So I agree. Yeah. Wow. So there are going to be new skill sets that doctors will have to start, yes, you're still an expert, considered an expert, but now it's how do you communicate that expertise so well that patient is trusting you, right? To kind of execute the plan and do what you recommend so that you can have better outcomes for that patient, right? And so, yeah, that's something that I think is really going to be key going forward for the future of healthcare.
Like the soft skills that we're taught, we're taught these things in medical school. You have like the hard skills and the soft skills, communication skills. And as a med student, you're like, I don't need that. I know how to talk to my patients, until you're in the patient's room. And now
Yeah.
you're having really, really, really intense conversations, life and death conversations. How are you going to convince this patient, or make sure that this patient is listening to you, making them understand that their disease is so severe that they can't just leave the hospital. You have a lot of patients who still leave AMA and things like what we call against medical advice, or you have a lot of patients who are non-adherent. I don't like to say non-compliant, but like non-adherent to a medical treatment. And sometimes it's not because they're hard-headed. Sometimes it's because their doctor just didn't explain to them why they need to be on these things. Like, what is the importance? Why is my doctor just prescribing me, sending me all these pills? So all of these skills are being taught and mentioned in medical school, but now it's the time to really start practicing it, because that's what makes you stand out as a doctor, especially in the primary care setting. A patient's not going to come, no matter how smart you are. And we used to say this all the time, like, patients won't care if you're top of your class. They're going to care that you are the doctor that took care of them when they were sick. The patient's not going to come back to you if they felt like, oh, this guy didn't really communicate well with me, or this doctor wasn't really helpful. So just hitting on those soft skills as well is very important.
Yeah, and I think that's across the board in every kind of field now, right? Being an expert, definitely there was a time for that where knowledge was kind of consolidated in individuals, or, it was in silos on the internet. But now, because it's so accessible now, now the ones who stand out are the ones who can build those relationships and show genuine care about the person and having that empathy about the other person that they're speaking to. So let's take a step back. I mean, let's talk about technology, right? You kind of hinted at with AI. My company, we kind of focus on remote care as a service, where we're kind of reaching out to patients in the home environment for remote patient monitoring, care management services. What are your thoughts about that, right? There have been stats that say, most people see the doctor like 1% of their lives, right? They spend the vast majority outside of the doctor, the clinic environment. So they're at home, they want to manage themselves. What are your thoughts about these advent of these tools and how they can be useful for you in the primary care setting as you think about, how you practice medicine?
I think it's amazing, honestly. Number one, it gives patients that sense of empowerment and that sense of involvement in their care. Before we had all of these fancy tools, we'd have blood glucose checking. They would prick themselves and they write it down in a notebook. And my very, like, the patients that are very invested in their healthcare are the ones that bring in a notebook and they say, Doc, these are my blood sugar numbers. Morning, fasting, before I ate, when I got my insulin, and things like that. And not only just sugars, but even in blood pressure, hypertension, they come in and they're like, these are the numbers I'm seeing, Doc. This is my number in the morning. This is what it looks like after I take my pills. This is what my blood pressure looks like in the afternoon. And it's not only empowering for the patient, but it helps us as physicians so much because you in the office, like seeing me in the office is just one point in time. It's just one data point. And I don't know if glucose per se, you can get like super, super high sugars because you're kind of nervous about seeing the doctor. I don't think
Mhm.
there's anything that but we have white coat hypertension. We
Mhm.
have, when they come in and their blood pressure is extremely elevated. And sometimes I'm sitting there and I'm like, this doesn't look right. You get an EKG on them. There's no evidence of high blood pressure because you can see that if there's some sort of structural changes because of the high blood pressure, it will reflect on your EKG strip. And sometimes you look at it and say, huh, blood pressure every time he's in the office is like 160s, 170s over 80s or 100, but the EKG is not telling me the same story. It doesn't look like it's a chronic problem
Mhm.
because they can get nervous. I would sometimes I get nervous and I go and see my doctor, even if I'm the doctor. I'm sitting there and like, oh my gosh, you still get the nerves. And just having all those data points helps you as a clinician, helps you and your patient make an informed decision. It's not about, okay, this blood pressure is 180 over 100 and last visit it was also 180. Let's go ahead and throw like a very strong antihypertensive. I've seen the mistake where we would do that and then they would come back in saying, hey, doc, I've been dizzy and nauseous and my blood pressure apparently dropped when I went to the pharmacy to go and check on it. It was like 90 over 6. I'm like, oh my gosh, because I over controlled you because that data point that I was making my decision on was not accurate.
Mm.
It does not show me what all the data points were going towards, right? Same thing when it comes to blood glucose checking or blood sugar checking. Sometimes you tell your patient, hey, I want you to get labs. We usually tell you guys, you need to be fasting. Don't eat for like 12 hours or so until you get your labs done. And then you have like a low sugar or sometimes it's a normal sugar. But interestingly enough, I was looking into the literature one time. It's actually the what we call the post meal, the postprandial sugars that actually drop first, or not
Mm.
drop first, but kind of go up first before you see it in the morning sugars, the fasting sugars. Just having that continuous monitoring of sugars, like okay, what is the range? And then again, it's not just about having that one data point where my patient has a high blood sugar of 400. I'm going to go ahead and chase that one data point with a bunch of insulin or maybe like scattered data points. And then I make my patient hypoglycemic. And that's even a bigger risk
Mm.
to them, right? Understanding that, wait, maybe the patient's blood sugar kind of ranges within, like, let's say if they're very, very, very diabetic, 200 to 300. That's
Mm.
their range that their body is used to. And we have to do this slowly. And just having these devices is just so helpful to make sure that we're making informed decisions and safe decisions for our patients.
No, you hit the nail on the head. I mean, it empowers the patient. We're seeing that. Also, it creates a deeper bond between the patient and the doctor because now the doctor is getting data and can kind of be a little bit more connected to the patient. The patient feels like they're being seen more. We're seeing adjustments with patients, not just with blood pressure and glucose monitoring, but other things that can help with the patient, right? Like say they need additional help or care, or maybe there's emergencies that happen that the patient wasn't aware of, like maybe they had a mild stroke or something, but because we were reaching out remotely using telehealth means, the patient, but we were able to kind of see that and get the patient 911 services, right, immediately. So just having that kind of connection is really important. And to your point, I think AI is great. I don't think, my belief is, as a technologist, I don't think it's ever going to replace doctors and clinicians because, yes, it can be very helpful in certain cases for diagnoses, but it does a thing where it tells lies sometimes, right? Because it just doesn't, it's not giving you the best context. So having a doctor that's looking at the data, looking at what the AI is giving them, and then putting that into context is going to be way more important. But we've seen the positive nature of AI where you can use it as a personalization engine. So, you're talking about patient engagement. How do you change up the language, right, to kind of meet the unique needs for each patient based on unique things around care plans? So like certain patients, they want to monitor their glucose because they want to get the A1C down before their daughter's wedding. Some want to, be able to dance more. So they want to get their congestive heart failure down so their feet don't swell up. So, having messaging around that uniqueness, and also cultural relevance like multi-language, Spanish, Hindi, Mandarin, text messages to patients that make it seem more connected. We're seeing AI being more positive effect to help with just making sure the patient feels more connected, to the doctor. So this is interesting. I would love to kind of just dig into a little bit about your journey in social media real quick. Talk about that, as a resident and putting your expertise out there. A lot of doctors are hesitant, right? Because, it's usually a one-to-one kind of expertise that you provide to patient, but now you're out there communicating to the world. And so people are probably asking questions outside of, areas that you may not be familiar with and things of that nature. So how did you navigate, number one, starting down this journey? And number two, what are your thoughts about the future of social media and how it can be used as a positive force?
It started off as like a tiny little mentorship page, if I'm being honest. I'm an international medical graduate from the Philippines, and so I lived half of my life in the Philippines, half of my life in the US. And what actually triggered me to actually come back here was during, or not during the hype, but when COVID had hit, and all of my family was already here in the US, and my mom actually was just very, very nervous about the state of things, right? And she was
Yeah,
just nervous
yeah,
that if I got COVID somewhere else, that things would
yeah,
go the opposite way.
yeah,
So that's how I kind of came over here and navigating through, getting through the system, getting, how do I, like, what exams do I take, what kind of, how do I get into residency, basically, how do I get through the system as an international graduate, was kind of the biggest hurdle that I ever had, trying to get in.
mm,
And it's because not a lot of us have that direct mentorship that, of course, US schools would have, because technically that's the goal of US medical schools, is to get them into the US system, right? I was very fortunate because so I'm from Hawaii. I actually pronounce it Hawaii, but and there was this one doctor. His name was Dr. Sunito, who has a primary care clinic back there. And because of my mom's connections with one of the other providers, Dr. Go, and his wife, Dr. Tan, they were able to kind of pull me into
mm,
this clinic where they were initially having me shadow and just kind of make sure that I was always, that I wouldn't become dull with my clinical skills.
yeah,
Basically, they were worried that if I wanted to go back to the Philippines, that I wouldn't have that clinical, the clinical skills would have been. So they're like,
yeah,
no, you should come over and just shadow. There are a lot of medical students or a lot of medical, I am international medical graduates as well, who are rotating in the clinic, trying to get a lot of US clinical experience so that they can try and apply for residency. And that's kind of how my journey started. I was just there, and then I kind of graduated responsibilities until I was like, you know what? Everyone convinced me in the clinic that you should just try to get just try to apply for residency here, and that's how my journey had started. By that time, I was already the preceptorship coordinator. So we had this whole preceptorship program where we had all these students, like medical students, all these pre-med students, and all these international graduates who were rotating with us. And that's kind of what my position was at that time. And I was just very heavily involved in helping, just simple things like, okay, this is how we're going to write up your CV, this is how we're going
Hmm.
to write up your personal statement, this is how, let me connect you with this doctor, oh, you're interested in endocrinology, let me hit you up with this, just kind of being that conduit, until I realized, wait, I've always been passionate about mentorship, but then I realized, wow, I'm really passionate about helping others navigate through this, because I didn't have that help, that I
Hmm.
didn't have that help initially, and just realizing and acknowledging the fact that I wouldn't be where I am today if I didn't have that. And that's where it started. So a lot of mentorship going on there, a lot of teaching. We would have lectures about primary care, just giving lectures on what the latest guidelines are to all these medical students and all these trainees. And then moving forward, when I graduated from the program and got into residency, I was like, what should I do now? Like, I can't just stop, I just can't stop helping people. So that's how the page came out. Initially, it was just like a very informative page. Like, hey, this is how you should. This, if you're interested in applying for residence here in the U.S., these are the steps. These are your tips. And then it kind of grew as I grew. I feel
Hmm.
like with social media, it's so difficult to stay in a niche. It's so difficult to stay in like one little category, because as an
Yeah.
individual, you're changing as well.
Hmm.
So navigating through that and kind of figuring out, okay, what goes on the private and what goes on the public social media,
Hmm.
right? So it's okay, what's my intention? Always figuring out, okay, what is my intention with this post? Because I feel like it's so easy to get ego driven on social media when you
Hmm.
scroll and then you get the likes and then you get the comments and then you refresh and then you refresh and then you refresh. And it always had to be, what is my purpose with this post? Okay, this post is about, it's inspirational. This one is kind of like to make, it's like a gag post. This is kind of like to make a little joke. This post is for medical education. This post is for advice specifically to the international medical graduates or medical students even just applying for residency. And that's how I've started to build the page. So there's like a little blurb there about USMLE advice, how to navigate through interviews, how you should be applying for what residency programs to be applying for, what should you be looking for as an applicant. And then I have a little blurb as well, like, okay, now as an intern, because I became an intern after all of that. So
Hmm.
advising as well, how to navigate through internship, how to excel in your presentations, what is a good way to stay efficient with chart reviewing in the morning. And then now, beyond internship, because now I'm done with that phase, I've kind of gotten the hang of that. Now I'm in this whole, okay, now as a senior resident, my purpose now is to be a leader on the team, to educate, make sure that my teammates are, learning, that I'm teaching my medical students. So now it's kind of three pronged at this point, where the third prong is just education. Sometimes I post a little, how do you read an X-ray, or sometimes it's, how do I talk to my patients about their code status. So a lot
Hmm.
of like the little skills here and there, and that's kind of how I've built the page. So it's grown with me as I've grown through this journey.
I love
Definitely,
it.
I've seen a lot of people who are also what we call medfluencers on social media, as well as, interestingly enough, in medical school, we were always taught about this as well. Like, how do you navigate being on social media and being a doctor? You want to have that perfect balance of, my patients can relate to me, but at the same time, my patients can rely on me. My patients take me seriously. I'm not doing anything that will ruin my credibility. So I
Hmm.
feel like it's such a very, very difficult balance to find, which
Yeah.
is why I said always having that separate social media here and there. Definitely, my big no-nos are HIPAA violations. You should not be talking about patients at all. That's why I'm very, very cautious about how comfortable I feel talking about experiences, unless it's, past and it's not something that someone can identify. Like, no, she's talking about me. So being safe on
Yeah.
that end as well. Medical education wise and medical information, it's just so easy to make up information nowadays. It's so I we see it all the time. Like, sometimes not even medfluencers, but you have sometimes business owners or people just on the web who propagate misinformation
Hmm.
about certain medical things, which is very scary. Like, I think even before social media was a big thing, we would even see it.
Hmm.
People would say, take all these herbal supplements, forget about your
Yeah.
cancer treatments, and then you kind of see it go the wrong way. So definitely, I think social media is a double-edged sword. Educate your patients. Definitely, you want to be able to educate them, empower them, but not give out, you still have to have proper consultations, I believe. It's not like, oh, if you have this, you should do this. It's always important to have a discussion with your doctor. So that's why I feel like social media can be very scary, a very, very scary place to navigate through. And it's, especially as a doctor, you have to be very careful with what you say. And, other people, and how you handle backlash as well. There will always be a group of people who do not 100% believe in the health system, or do not 100% believe in the medical advice, right? And it's just, again, just a balance of trying to figure out how much you want to be on social media, how much you want to not expose, but how much of yourself do you want to show on social media, how much do you want to share, at what point is oversharing for you, what is your intention with every post you make, and then go from there. I think it's just making sure that you have all of those principles in line before trying to make a page and
Yeah.
yeah.
And you definitely got to
Being
build it from the
creative.
foundation, right? To your point, what's your intention with trying that post? I had two different doctors, a nephrologist and a cardiologist. The cardiologist mentioned to me the reason why in our podcast, Dr. Hassan, go check it out. But he mentioned the reason why he started his social media journey was because he kept answering the same questions. So to him, doing social media was kind of like FAQ, right? So patients or anyone had questions. He said, "Hey, I already talked about this, right?" I gave a deep dive on that. And so for him, it became a way to kind of lighten his load a little bit and also kind of help folks, right? And then I was talking to Dr. Refi talking about nephrology, and he became really involved because, to your point, the misinformation is out there, especially during COVID time. And so he came up with, scenarios and opportunities on how people can breathe healthier, right, online, and understanding different things from a medical standpoint that makes sense. And so, yeah, I think you're right. You guys are considered experts, making sure you kind of meet those guidelines intention, understanding your audience, no HIPAA violations, and then making sure, you stay focused on what's important and the value that you bring to the channel. And I think if you kind of keep those guidelines in mind, most doctors can be successful. So that's awesome. Well, Dr. Shirley, this has been amazing. Thank you so much for your time. Where can people find you, especially as they're navigating, trying to start, the transfer from international and getting here in the United States, or just in general? Your mentorship, I think, can affect help anyone that's looking to start their journey down a path toward, full-fledged doctor.
So I am on Instagram. My handle is at shirleyann.md. So SHIRLEY, like Shirley Temple, I always say. So Shirley Ann, ANN dot, like period, MD. And just
Awesome.
navigate through the page. I hope that all the content I put out there and I continue to put out there is valuable to all of our listeners here today.
Awesome. Awesome. Well, thank you for your time. Everyone, go check that page out. Please hope you continue to listen. If you want to listen more to other expert advice, especially as we navigate this new normal of healthcare, go check out our next podcast. Thank you for your time, Dr. Shirley.
Thank you so much for having me. Have a good night.
Good night.